Hamstring stretching can aggravate your lower back pain. Believe it or not. Hamstring stretching can aggravate your lower back pain. Believe it or not, hamstring is not the common cause of your lower back pain. For most people, stretching the hamstring is the first thing that comes to their mind that will help relieve their low back pain. You started stretching your hamstring and you like how it feels. You feel better immediately and feel that it's good for your lower back. The next day, it seems okay, but still feels tight, and you hope it is better. Until late afternoon, you feel the same nagging pain cycle is back. You think since the stretch to the hamstring feels good or maybe relieving, you thought probably more stretch and intensity will be better. End of the day, after work with lower back pain escalating again, even the hamstring feels sore and tight again. You position yourself on your back and get ready to your plan B. More stretch and more pulling. Day after day, you do this expecting the hamstring is the key to relieving your back. But the pain recurs as the day passes. For a while, you even thought it's getting worse. You couldn't get a quality sleep at night and you have difficulty moving normally. Are you one of these people who thought that stretching the hamstring is the solution? Do you think more flexibility to your hamstring will resolve your annoying lower back discomfort? You probably be on the right track if your plan works for you anyway. If it's getting worse, then this topic might help. Lower back pain is a very common problem, once complicated by a DIY or do-it-yourself approach remedy for a period of time. But the positive side of common low back pain is majority mechanical cause in nature. Means it is all about alignment and imbalance cause. This is brought about by muscle not being used properly and neurologically disconnected. As a result, the physical biomechanics is not efficiently working, causing damage to joint structure and manifested and expressed as pain. Hamstring is the only secondary cause, and stretching a wrong muscle can complicate a lower back pain. If you spend sitting the whole day, beside the buttocks under you, next is the adjacent hamstring. If you think about your anatomical position when you are sitting, the majority of the length of the hamstring muscle is not really in a shortened position. It is actually stretched out and flattened by the weight of your upper body, which you should know it blocks and slows down the blood circulation. An obvious reason why it gets sore after hours of sitting. This is no difference in patient confined for hours in bed, resulting to blood pooling of the back side of the body. That is why bedridden patients are required to be scheduled for turning to prevent immobilization or tissue damage. Assuming you have a project that has a deadline, that upper body dead weight on your buttocks and hamstring is not forgiving. Even if you have the most expensive chair, an office chair underneath your ass, that same chair would not even save your lower back whatsoever. Do you need to stretch your hamstring if you have a back pain? The answer is yes. JC, you are confusing me. I thought you said you don't need to stretch the hamstring. I said the hamstring muscle is not the common cause of your back pain. And that is why hamstring should not be the focus of stretching. Let me explain further. Pay attention now. In my experience, people follow too much on how they feel without understanding the basic science behind pain. Hamstring muscle usually are sensitively expressive, and it is just right for you to listen closely and pay attention. It is how you respond that matters most. Usually, people respond by intensely stretching the hurting hamstring muscle without thinking first if it really needs more lengthening stretch or just light to moderate is enough. Most of the time, hamstring muscle only needs to recover from being stagnant and compressed from sitting too long. Therefore, A low to moderate stretch would be enough to regain back its comfortable condition. Is the compression caused by the hamstring muscle which put stress to the lower back spine? The answer is a big no. Mechanically, the most common muscle that is causing low back pain is the psoas muscle, a part of the hip flexor. When you are in sitting position, this muscle is in a shortened and fully inactive. The amount of time you spend sitting will dictate how short this muscle will become. The moment you need this muscle to move is also the moment it will start pulling and increasing the curve of your lower back spine. Same with active people. Hip flexor is shorter because it is stronger than the hamstring. And hamstring always gets all the attention when it is time to stretch. This aggravates the curve of your lower back. Once it's reached an extreme curve, it also increases the stress to the backbone. Hamstring muscle not only get deprived of nutrients and oxygen due to your upper body weight, but also get irritated from its nerve due to the repeated stress brought about by increased curve of your lower back. So why overstretching the hamstring muscle will complicate your lower back pain? For the most logical reason, it is better to examine the efficiency of your hamstring against its opposite hip flexor muscle. The ratio of both flexion and extension or forward or backward motion of your leg should be close to ideal range of motion, or at least should be close to being balanced with each other. A very long hamstring plus a very short hip flexor or psoas muscle is not acceptable. Another reason why overstretching happens is when only one hamstring is intensely being stretched, eventually developing a right and left hamstring discrepancies. In short, one hamstring is too flexible compared to the other hamstring. Both of this lower body imbalance or imbalances delivers uneven force up to your lower back as you start to step forward. The more unevenness you are, the more damaging stress and compression you produce. So, how will you know if you really need to stretch the hamstring? Let me rephrase that question to how will you know if you have the same range of motion on both sides, and is it in its ideal range of motion? First, do not rely on how you feel. Tightness sensation does not equal to a limited range of motion. In short, you feel sore or tight, it does not mean you need more length by stretching more. Use your visual ability to differentiate your right to your left side. If that does not work, seek for a range of motion assessment from a professional stretch therapist. After checking your bilateral balance, next is how much range of motion do you have. This is a good example of how you assess by yourself. Find a vertical support such as a frame of your doorway. Here in this photo, I use the stretch table foot edge to show you what the range of motion of hamstring should look like. Hamstring muscle or hip flexion of the joint should be able to reach at least 90 degrees to be considered healthy range of motion. In my years of practice, people with chronic low back pain that is always recurring have less than 90 degrees of hip flexion range of motion. Although the most accepted range of motion is 120 degrees, I have seen and stretched several marathon runners have no problem with 90 degrees of hip flexion range of motion. If you are sure and positive that you have the right and left range of motion imbalance, or your range of motion is below 90 degrees, then you need to stretch for lengthening and meet the required ideal range of motion. Whatever progression you achieve with this goal will be beneficial and will have a contributing effect on reducing the lower back pain. What if you have that ideal hamstring length? For some people, they even have extreme range of motion, which is above 120 degrees of range of motion. Then, going for a more length or more range of motion is a waste of time and won't even fix your chronic low back pain. It is highly likely you will aggravate your back pain and complicate the issue. If this is the case, then avoid stretching the hamstring. Yes and no. You can still stretch the hamstring for maintenance and to recuperate, maybe from your exercise, too much sitting. What you want to avoid is to intentionally further increase your range of motion. This happens with people who rely and very dependent on pain sensation. Listen closely. Again, when you don't feel the stretch, it does not mean there's nothing happening. It will always have a benefit, and it all dependent on your goal or the competent intention of your stretch therapist. In fact, the less pain stretch you feel is better, instead of you cringing on every application of stretch. A slight irritation coming from stretch and challenging is just enough. There are other factors affecting low back pain, and hamstring muscle is just one of the common area where we commonly experience frustrating sinking or nagging sensation, which is a reason for us to follow our body's message. But this leads us to tendency to stretch the hamstring muscle, even though it's highly unlikely that it will fix your low back pain. I hope this is clear enough that hamstring is not the key to relieve your low back pain, and that you have a higher chances of relieving your low back pain by stretching a common short and tight psoas muscle or the hip flexor muscle group. Repeat this video if you're still not able to fully digest the concept around hamstring muscle in relation to your low back pain. For listening, this is Jace Lee. I am an active, isolated stretch practitioner.